First, I'm going to do a QSIN on Miss Matthews. I'm going to check her wristband, make sure that her name and date of birth are on them. I would check her board to make sure everything's updated and correct. I would look for any tubes. She has no oxygen on right now. She does not have an NG tube, no chest tubes, and no catheter present. She only has a left saline lock in her left antecubital space, and I would assess it for redness, swelling, and drainage, and there's none there. And she has her call light within reach, 3 side rails up, bed at the lowest position. There's no obstacles in her way. And now I'm going to do a head to toe assessment on Miss Matthews. Hi Miss Matthews, my name is Grace. I'm going to be your nurse today, and I'm going to do a quick head to toe assessment on you. First I'm going to wash my hands. I'm going to put on some gloves. And can you tell me your name and date of birth? And do you know what date it is today? Okay. And do you know where we're at? Okay, so she's alert and oriented times 3. I would ask her to, can you push against my hands? Can you pull back against them? And can you wiggle your fingers for me? And can you tell me what finger I'm touching? Okay. I'm going to check her skin turgor. It is poor, it's tenting. She has no edema in her upper extremities. I'm going to check her cap refill. Less than 3 seconds. Her skin is is pale, and so are her nail beds. And I'm going to check her vital signs now. Gonna check her temperature. Can you lift your tongue up for me? And it is 97.6 degrees Fahrenheit. And now I'm going to check her pulses. They're present bilaterally. And her pulse is 85, and it is strong and regular. And now I'm going to check her respiratory rate. It is very deep and labored and rapid. So I would say those are Kussmaul respirations. And I'm going to take her blood pressure and her left arm sitting up, and it is 123/77, which is within normal limits. And I'm going to check her pulse ox, and it is at 96%. And she is cool and clammy and pale on her skin. And I said her skin turgor was poor. I checked it up here. Okay, are you having any pain, Miss Matthews? No, she denies pain. So I'm going to listen to her lung sounds. Take a deep breath in and out for me. Okay, her lung sounds are clear bilaterally. Her chest is symmetrical when breathing in and out. And she's having labored and deep, rapid respirations. Are you having a cough at all, Miss Matthews? She denies a cough, so then it's non-productive. And she's not on any oxygen as of now. Alright, now I'm going to listen to your heart. I'm going to check her apical pulse for a full minute. S1 and S2 are present. I already checked her cap refill, it was less than 3. There's no JVD present here, and I'm gonna lower her head. No JVD present there as well, so none noted. I already checked her 6 Ps, so I'm going to check out your abdomen, Miss Matthews. I'm going to take a listen to all 4 quadrants. Okay, bowel sounds active in all 4 quadrants. Can you tell me when your last bowel movement was? Okay, yesterday. Are you passing any gas or belching? And are you having any constipation or diarrhea? And are you experiencing any nausea or vomiting? She denies that. And so are you having any urinary frequency or burning or pain anytime you urinate? So she says she's been urinating a lot lately. And I'm going to assess her. I already checked her IV site, so I'm going to assess her feet now. Can you push against my hands? Can you pull against my hands? And can you wiggle your toes for me? Okay. And can you tell me what toe I'm touching? Okay. I'm going to check her cap refill. It was less than 3 seconds. There's no edema present in her feet. Are you experiencing any numbness or tingling? Okay. So, based on her assessment and her complaining and her respirations and complaining of urinating a lot and losing weight, she is likely in diabetic ketoacidosis, so we are going to treat her with IV fluids and regular IV insulin to get her blood pressure down, or her blood sugar down is what I meant, her blood sugar. And hopefully we are going to check to make sure she has the proper diagnosis of diabetes, and we're going to get her treated for her diabetes. And now I'm going to report off to the nurse. Miss Matthews is a 16-year-old. She was brought into the ED of collapsing in school. She was pale and weak, and her blood glucose read to the max by the paramedics. So additional assessments showed customary breathing. She had fruity breath and reported
Can't take my nose from running.
a 10-pound weight loss over the last 2 months, despite eating all the time, and her serum glucose was 523, and her urine tested positive for ketones. So the provider diagnosed her with diabetes, and she was treated for diabetic ketoacidosis with fluids and regular insulin IV, and she was able to demonstrate proper technique of insulin. She chose to use that insulin pen, and her blood glucose levels are stable between 140 and 180, and she should be set to go home today.
You about ready to hit the bricks, Pat?
No, honey.
Yeah.